everyone. My name is Joie-Claire. I have been hired as the Assistant Manager of the Department of Human Resources at Stronger Medical Hospital. In this video, we're going to learn more about the healthcare industry and different career paths that a person might follow. So first of all, there are different paths, health career industries that one might follow. Some are non-clinical and others are clinical, where people directly deal with patients and take care of them, while the non-clinical career department is all about supporting the well-being of patients through providing them different services. In the healthcare industry, some examples of non-clinical health careers are the medical assistants, who are in charge of processing information about the medical records of all the patients, and we have health information managers or technicians who are in charge of keeping the records of all patients within a healthcare institution. And there are also medical secretaries who actually deal with papers in offices of doctors and nurses, things like that. And talking about the clinical healthcare careers, these are the people that directly deal with patients, as I have been saying previously, and these people are doctors, nurses, like pharmacists who provide medicine to patients. And the next thing that I'm going to talk about is the allied health professions, which are the segments or foundations of healthcare fields that provide services and identification, evaluation, and prevention of different diseases and disorders that might arise due to different treatments that are offered to patients. So the allied health professions are in charge of identifying and evaluating different medical treatments that are prescribed to different patients. And the next thing that we're going to talk about are different categories that are found in these allied health professions. The first category is the category of technicians, and these are trained people who perform different activities, and they work under the supervision of therapists who are in charge of providing directions to these people. So the technicians, some examples of technicians are like the cardiovascular assistants and different ophthalmic medical technicians who are in charge of assisting doctors or people who are specialized in different medical fields. And the therapists they have a higher educational they undergo a higher educational process compared to technicians, because they're the ones who direct them about what they should do and what they shouldn't be doing in the healthcare career. And some examples of therapists are they are neurodiagnostic doctors and different pathologist assistants and other people who directly deal with patients through providing directions to the technicians. And the next thing that we're going to talk about are different types of nurses. We have registered nurses who have different educational degrees compared to other nurses. These registered nurses have master's degrees in medicine, and their educational degree is higher compared to the degree of LPNs, who are licensed practical nurses who provide basic needs, nursing services to the patients. And the registered nurses are in charge of supervising and directing the delivered services by other healthcare personnel like the LPNs. Before wrapping up this video, let me first take you back through the meaning of registered nurses. These are nurses that are in charge of directing and supervising the healthcare personnel like other LPN nurses in order for them to be able to provide good quality services to patients. In order to become a registered nurse, one has to have a master's educational and clinical practice requirement beyond basic nursing education. And other types of nurses are the ones known as LPN. In full words, it means licensed practical nurses. They provide basic nursing services to patients, and in order to become an LPN, one must have completed a state-approved educational program, which takes 1 year in order to be completed. All these nurses are in charge of providing good quality nursing services to patients in order to improve their health. So as a conclusion, the healthcare industry is broad and one can choose a different career based on his or her passion, and one can choose to indirectly connect with patients through providing different programs, and another can use to directly connect with patients through working as a doctor. So thank you for your attention.